Hey everyone, welcome to this week's episode. As I just mentioned here in the intro, I'm here with my good friend Vashti, who is also an amazing colleague of mine. And we decided that we wanted to talk about what we're seeing in our practices around COVID, long COVID, how these are impacting different areas of our bodies, right? So, one of the big things I think a lot of people have probably seen in the news and maybe experienced personally, if you're a menstruating person, is a change in your period, right? This is a very sort of well known thing, I would say, at this point, that it can throw off your period for really up to 3 months. I have seen with my clients, most of their doctors are actually speaking to that. So that's a pretty well known post COVID thing. Have you seen that also with the vaccine, that can happen too, that the period's thrown off for a couple of months?
Yeah, I
Yeah.
have. I should say hi. Thank you
Oh,
for having
yes.
me on the
Hi,
show. It's
welcome.
great to be back.
That's like, we're just
um,
diving right in.
yeah, we're gonna go get it.
Yeah.
Yeah, I've had several clients who had period irregularities, menstrual
Mm-hmm.
irregularities. For a few months, they did shift back to normal after a while. But yeah, that's
Mm-hmm.
something that we're definitely seeing. I know that there's been several studies, and the University of Chicago is doing some
Mm-hmm.
big study on people. So that's something that is out there, and I'm glad doctors are speaking to it
Yeah.
now.
Yep.
Um,
Absolutely. And I would add to that too. I've had this happen with several clients where, particularly late last year, they may have gotten the booster and then literally 2 or 3 days later got COVID. And I'm not saying that those are,
yes.
because of each other, but this is especially with Omicron when it was so prevalent,
Mhm.
and so it just was that kind of intense viral overload at that point. And I definitely say in those cases, if that's something that happened to you, to maybe even give it a little bit longer for your period to regulate. I think in most instances it's 3 months or so, but if things are still off at 5 months, like, don't be too freaked out. Maybe past that, you can start to think about, okay, what else is going on here?
Right. Yeah, for sure. Because you're just carrying a huge viral load at that
Yep.
point.
Yep. Absolutely. And your body's like just trying to work with it all. So,
Yeah.
so tell us what you have been seeing, because you work so much with people with thyroid disorders. And, I know that you have a community of people that you work with too, in terms of what they're seeing with their patients and clients and stuff. So
Mhm.
tell us what's going on with the thyroid and COVID.
Well, it's interesting because I don't think that a lot of people thought, oh, how is thyroid or COVID impacting my thyroid?
Mm-hmm.
But there are several studies that are out there, a bit inconclusive on how the long-term effects of that
Mm-hmm.
COVID are having on our thyroid, but that there are definitely effects in that viral stage, because our thyroid impacts every cell of our body pretty
Mm-hmm.
much. So it's not really surprising that that's happening.
Yeah.
But some things that we're seeing are hypothyroidism popping up,
Mm-hmm.
a lot of flares in autoimmune disease across the board,
So
not just in Hashimoto's.
people that didn't previously have autoimmune diseases too, or
Some
did they
of that,
okay.
yeah, and
Mm-hmm.
they've likely had as with autoimmune diseases, COVID could have been that trigger.
Mm-hmm.
Right.
Absolutely. Mm-hmm.
And so now you have maybe elevated antibodies, which people are seeing,
Yeah.
are the elevated antibodies. And then if you already had an autoimmune disease, something like Hashimoto's, for instance, we're seeing a lot of flares.
Yeah.
That personally happened to me. I've been in like a 6 month long flare.
Oh my goodness. And I just want to kind of add to that for people that don't necessarily know this information, that viruses very often, especially big viruses like this, can cause a lot of havoc, wreak a lot of havoc in your body,
Oh
right?
yes.
And like you were just saying, it's like our bodies can kind of keep things, together for a while, even if there's sort of some autoimmunity at play, but you don't really know that necessarily. But
Mm-hmm.
then a big old virus comes in and just it's like dropping the bomb. And then all of a sudden the body's like, okay, here we are, like guns to the races, because obviously your immune system is kicked up to fight the
Right.
virus. And so,
Exactly.
yeah.
And then if you already have an autoimmune disease, you can be like pretty good, right?
Yeah.
Like, I have mine well regulated
Mm-hmm.
and I do all the things for that. But then these moments, like a virus or huge amounts of stress, or those two things coincide
Together.
together, then you end up with a flare, and that can look different for everybody. But that is something that we are seeing really in a lot of our patient population.
So is, from the studies that you guys have seen, even though it's obviously been a small population so far, and I just want to kind of speak to that for a second, because this hasn't been around very long, particularly the long COVID part of it, right? It's a pretty small population still at this point that, has been dealing with that. We don't even know really how long COVID will last for people, right? Like, is it going to be a 2-year thing? Is it going to be a multi-year thing? What does that look like? And so we're kind of just trying to figure out, based on small amounts of evidence or populations at this point, sort of what we're going to see. But are there things that are helpful that you know of, that can help if you're in a flare due to COVID? Yeah.
Rest.
Yeah. The one that no one wants to
the one that no one wants to talk about or think about or do is, rest. It varies from what each person's thing is, but it might be zinc or, liposomal glutathione to just sort of help you get past that. Something that's hard for me to remember to do always. Right. And then maybe I think also it is movement. People tend to not want to move when they're in a flare, but it's the movement that feels good to you. That might be just restorative yoga, where you're just doing gentle stretches or something, or a walk or something, but still maintaining that. And then of course you would want nutrients, an uptake in your nutrients if you're feeling like zinc or whatever is low. But you could also see, if you want to get some blood tests run, what you might be.
Right. And I think that's a really good point to, that can be, especially if you're sort of 3 months out or so from having COVID and there's still issues going on, like get those basic blood panel done, and that can guide you a lot on sort of the nutrients that you need. Yeah.
Kind of the path maybe to feeling yourself again.
Better,
and getting through that flare. I love IV therapy.
I was going to ask, if you think that that's a good thing to do for people to do in that situation? Yeah.
I mean, I live in Curacao, and that's not really happening here.
I was going to ask, is it there? Yeah.
No, but I am already booked for when I get to Seattle.
You're like, it is on the list.
It is on the list. And again, that depends, but that might be very helpful for a large population. And kind of what we're seeing in the studies is, it can be transient hypothyroidism, but you also kind of want to then track that.
Yeah.
Because you don't want to get into a place where you're, in full on hypothyroidism and dealing with that, when you could have, maybe seen that over a couple of rounds of labs if things are continuing to deteriorate.
Yeah. Don't just like give it wait and watch and see over like years. Cause that's, the stuff can really go down pretty quickly. The nosedive. Yeah. Well, the thyroid I always think of as just, it's such a like sweet little, it's strong and sensitive at the same time. Right. And so
and we need it.
Yeah. And we definitely need it
we need it for everything. For our body, for our metabolism, for everything to go. And when it's not, we're not feeling our best either. No gas, no go.
Exactly. Absolutely. I don't know if I told you this, but one of the other episodes that I did recently with Dr. Tanisha Wards, if anybody wants to go back and listen to that, it was a great episode, but she taught me about using topical glutathione for Hashimoto's. Right. Like, I was like, that's really fascinating. Particularly there's, I guess, several different products out there, but Apex has a really good one. And that, just putting it directly on your thyroid can be super helpful.
Oh, that is
Right.
really interesting and not something that I knew
Yeah.
about.
Yeah. She said she had learned about it, I think, from a conference. So I was like,
Okay.
thanks for that tip. And actually, I
Yeah.
started using it myself. And
Okay.
people, I think, whoever subscribes to my newsletter has already seen this, but she mentioned that it's also just good for skin, right?
Skin.
Yes. Because this particular formula also has, I think, alpha lipoic acid in
Hmm.
it and a couple of other, antioxidants and stuff. And, I have rosacea and it's been fabulous for
That's
my skin.
amazing.
Yeah, super soft. And like, I mean, it's actually cheaper than a lot of the, skincare
So,
products out there.
right.
So I'm all about it. I'm like, put
Gonna have
that
to try that.
glutathione. Yeah, exactly. Put it all over my
Put it
face.
on.
Yep,
Yeah,
exactly.
I'll have
So
to try that because that could be really helpful for people, especially if you have, clients that don't like taking
yes,
supplements or
exactly.
liposomal glutathione doesn't taste very good, so it can be
Yep.
a barrier for people to take it. So if there's something that's more easeful for people, that's great. I
Absolutely.
will
Yeah.
check that out.
Yeah, I was like, I'm passing along the great info to everybody that I know because I think it's fabulous. But yeah, I
Yeah,
thought that was cool because I don't think I even realized there was a topical glutathione before I talked to her. So I mean, it makes
yeah,
sense that there is, but um,
right.
yeah. So connecting to the place that I focus on a lot in my practice is gut health. And there's
Mhm.
definitely some studies that are coming out on how COVID impacts gut health. So I'm going to pull up one that I have right here. So there was a study done in Brazil, and this was very recent, just in the last couple months. And so basically, what they found is that there was considerable alteration in the gut microbiota composition and diversity after having COVID. And it really seems to be impacting the possibility of having long-term COVID issues, or long COVID. And so yeah, so it says in the current study, the scientists have investigated the involvement of gut microbiota alteration in actual triggering those post-COVID symptoms. So
Wow.
I think that's fascinating because I personally experienced a change in my gut microbiota post COVID.
Me
And,
too.
I've talked about it here on the podcast before that I had a relatively mild COVID, to where it was really just one bad day and then like 2 other days of like horrible headache. And I didn't really seem to have an impact on my stomach at all. I barely had any congestion. So I was like, sweet, scot free. But then I would say probably about a month later, my digestion just started like feeling very upended, you know?
Yeah.
And I actually have started to notice this too with some of the GI maps that I was running on people that, more opportunistic bacteria is showing up. H. pylori is certainly showing up. And that's kind of what happened with me was this like reoccurrence of H. pylori that, had happened. I'd had several years before. And for those that don't know, H. pylori, that lives essentially in your stomach, a little bit in your upper small intestine, but it can really impact your ability to break down foods because it does not like HCl, hydrochloric acid, which is so important to digestion of protein. And so it limits our hydrochloric acid output. And I'll tell you personally, I was like taking so much HCl and I was like having gas and bloating. And I was like, I don't have gas and bloating,
Yeah.
and often people with H. pylori will experience like acid reflux. That's kind of a traditional thing,
Hmm.
or GERD or any of those kind of, ulcers and things like that. And I didn't have any of those symptoms, but that gas and bloating was just like not chilling out. And so finally I was like, oh, okay, this makes sense that this is just how it's showing up in me because it doesn't matter that I'm taking all the HCl, the H. pylori is like, no, no. So I
Yeah.
wasn't breaking down those foods, so they were causing ruckus downstream.
Yeah.
So, I think it makes perfect sense. Like there's all these studies about like if you get in a car accident or you have any kind of head trauma, it like immediately kicks in leaky gut,
Yep.
like immediately, right? And it
Yeah.
takes quite a little bit of time for that to even calm down that reaction. And so if you think about this huge intense virus taking over the systems of your body, and it's like all systems go on that,
Yeah.
it's going to impact your gut, right?
Yeah, absolutely. And I think it really takes hold where we individually tend to be weakest, right? Because I've seen people with it just really long COVID lung issues. Some people with really, like gut is one of the ones that we see a lot. That's the same issue that I too have had, is really an upended digestion. And I think we both had some of that transient fatigue.
Yes, absolutely.
The general malaise.
Mm-hmm.
I recently had costochondritis, which is just like really
right. We didn't even have a chance to talk about that earlier. Oh my
interstitial inflammation,
yeah.
which my doctor believes is from long COVID.
Oh, wow.
And because I had been sick, this is just it came up in that moment of like my own body's not weakness, but like
Right.
viral overload,
Yep.
right?
Right.
And so that's where it reared its head, because I had high viral numbers, I had big inflammation numbers, and this like really terrible interstitial pain. So
and you had when did you have COVID?
Well, I tend to like always test negative for it, which is funny, but I know I had it when I was in Nigeria back in the early days of 2020, when we were living in Nigeria, and we didn't know then what it was, but now looking back, we all had the same thing, and it was most assuredly COVID. And so then I hadn't had any real issues from it. However, my husband has had long COVID sort of respiratory issues since that time. But then it was after I had my booster shot that is when I really started having kicked off. But it's this spike protein. It's the vaccine is neutral. It just my terrain is such that it didn't love that.
Right. And yeah, we want to kind of stress that point that the neutrality, it's really what the terrain is in our personal bodies. And exactly. We, because also the vaccine hasn't been around for a long time, we don't know these different, terrain is always going to be individual, right? So you can't really like classify, but over time we will learn more and more, like if you have a predisposition towards heart issues, maybe, then maybe we're seeing more and more of that sort of with the vaccine. So maybe that's not the best for your group, and things like that. And so, yes.
So it's just fascinatingly, it's fascinating and yet very frustrating all at the same time, right?
Yeah. And I will just add to that too, one of the things that I try and make clear with my clients is a lot of times, whether you had COVID or the vaccine or both, similar things are showing up for people.
Yeah, absolutely.
So it's like, I don't know if there's like a way that you could win ultimately, obviously the vaccines have helped save lives over the last couple of years, or I guess year and some. I know, I can't remember. I was like, how long have they been out? But, there's just this reality of how things show up. Sorry, you cut out.
Oh, did I cut out?
You cut out for a second. Yeah. Oh. So you can say it again. I'll edit that.
Oh, I have no idea what I was saying.
I'll just go on to, basically seeing very similar symptoms in people, whether it's one or the other, or both ultimately. And so here we are just doing the best we can with the situation at hand.
Exactly. We just don't know. Right. Yeah. And when I sort of pulled some of my colleagues that I work with, they're seeing a lot of the same stuff that you're talking about, and that I've seen as well, which is this sort of transient immunosuppression from post-COVID and the vaccine, which you would expect. Right. Yeah. But then these autoimmune flare-ups across diseases with both the vaccine and long COVID. And then one really interesting thing is these high levels of ferritin, which is how we the body's storage form of iron.
So tell us what that means.
You're sort of having then immune suppression at that point, because you've sequestered
all of your
iron, right? So then your body can't counter what it's trying to fight, right?
Oh, I see.
So that's interesting.
Yeah.
And then dysbiosis, which we've
Mm-hmm.
been talking about, the opportunistic strains of bacteria, and a
They're
lot
like,
more.
sweet field
Yeah.
day.
Ooh, bacterial versus viral in
Mm-hmm.
that instance. And then they are seeing elevated TPO
Mm-hmm.
antibodies, which is
Mm-hmm.
part of a full thyroid panel and something that often shows if it's elevated, really even at all, is can be indicative of autoimmune activity. So then what they're doing is, sort of interventions based on whatever that unique individual's needs are in front of them, right? And then sort of tracking with the TPO.
Right. That makes sense over time. Yeah.
Yeah, over time.
And just kind of speaking to one of those points, like, it definitely seems to also kick up latent viruses
Oh yeah, like
in people.
EBV.
Exactly. I was going to say EBV. That's actually what Dr. Wards and I talked about. She said all of her clients that have long COVID that have come to her have reactivated EBV.
Yeah.
So that's not surprising at all, right? It's like
No.
viruses kind of like to travel together and hang together.
They like to hang together and they live within us. Once you have it, it's there and they don't go away. And
Right.
many, many people have EBV by the time they're 7 and they just don't know.
They just
right.
don't
So
know.
then it's just there and it's waiting to be reactivated.
Yeah.
When you have something like COVID, Lyme, any of these
exactly
things, that's what happens.
Yeah.
So seeing that. And so I think doing stool tests can be very helpful in this instance too.
I'm curious, the GI map has EBV marker on there. But I know I've learned at some point, and I can't quite remember what it is. If I know it has to be active, A, to show up on there, but B, I feel like I learned at some point it had to be like the first time you had it. Is that right?
So it's not showing reactivated.
Right. I don't think it shows reactivated, but I could be wrong. So I don't want to say that 100%, but I remember that learning something about that at some point. Do you have a test that you utilize for EBV or that you recommend?
Not lately.
Yeah.
I haven't.
It's just not really great tests, right? Yeah.
But it's out there.
Yeah.
Prolifically out there.
Yeah, for sure. And working with a doctor that really understands how to deal with EBV is really important.
Exactly.
Yeah.
Yeah. So I think we're just seeing this whole new sort of, in one study I was reading, it was like sort of the pandemic of the pandemic, right? In this long COVID sort of people like you who had, mild symptomology of COVID ending up with these longer things that we don't, and nobody really has the answer because it shows up differently. There might be very similar things in people, but it shows up differently because we're all individuals, right?
Totally. Yep.
And
absolutely.
so it can make it hard to have like a specific thing. Oh, you have long COVID, go do this.
Right. Absolutely. Yeah. And it is interesting too, because I think some people think of long COVID as only like extreme symptoms, right? Like there are people obviously that struggle to get out of bed and like and so in my case, like, I don't think a lot of people would necessarily think like, oh, long COVID, but that idea of like, yeah, if it throws off your gut bacteria and these things are happening, like that is the long-term repercussions of that, or they longer term rather than just the viral episode. Yeah. And yeah. And one other thing too, I know we talked about earlier that I have seen a lot on testing when we run blood labs is an elevated high sensitivity C-reactive protein, which for those that don't know, is a specific inflammation marker for your heart. So you can get, just C-reactive protein, and that's kind of a basic all around the body inflammatory marker. It doesn't tell us specifically where the inflammation is happening. That HSCRP, sometimes called cardiac CRP, is going to tell you that it's about your heart. And I will say, ever since the vaccine, people started getting the vaccine, those numbers have been coming back high. I also think it's probably post-COVID too, but most of my clients have had the vaccine so close
Yeah.
to having COVID. It's hard to differentiate that, but for the most part, I, have, after kind of figuring that out after the first few clients, I said, let's retest in 3 months. And pretty much everyone that HSCRP has leveled back out. So don't freak out too much. That's not even a marker, honestly, that a lot of doctors are going to run on a basic blood panel. So you're probably never going to see it. But if you do a more advanced one, or you're, working on heart health in any form or fashion, and you're anywhere close to having had COVID or the vaccine, don't necessarily freak out if that number is high. Just give it 3 months and retest it.
Right. Yeah. It's a lot like, with the period issues that people are seeing. Yeah.
Absolutely. Yeah. So, I mean, really, we kind of wanted to just chat today about how you may see this show up in different forms of your health, because although we're starting to have more of that conversation now, and I think there's much more discussions about long COVID, to get into these like specific areas that it can hit the body, you may not realize essentially that was connected to this situation.
Right. Yeah. And we're not often taught that all the things can be interconnected. Right.
Absolutely.
And that's how we practice, is finding the interconnectedness. And so it is all connected.
So if you, if there's some people that are feeling like they have some thyroid issues now that they didn't before they had COVID, what do you recommend that they do?
I would recommend getting a full thyroid panel. And so we're going to want to look at, a lot of doctors just want to run TSH, maybe free T4 if you're lucky, but we would like to see, those two plus free T3, total T3, reverse T3. And I think reverse T3 is one that often gets sort of put to the side, but I think especially in a long COVID or, post-COVID state where your body has been under a great deal of stress, it would be really ideal to look at those, because it could be taking that receptor space that T3 would generally be at, and you're going to be not feeling good, right? Because you have these high reverse T3 numbers. And then we always want to test for the autoimmune component, and that's going to be TG antibodies and TPO antibodies. And both of those, if possible, sometimes doctors want to run one or the other.
Yeah.
But
they should always run together. Like, I don't understand.
They should run together, because some people have TG and some people have TPO, and not often do they both have both.
I don't think I've ever seen anybody have both.
Yeah. So it's very important to have all those components there. We could take a look at, and then we would work sort of off your symptoms, and obviously your symptoms, especially in thyroid, we do with everything, but with thyroid specifically, it's like symptoms and labs, because labs can tell you one part of the story and your symptoms can be saying something entirely different. And the reference ranges tend to be pretty broad, especially in thyroid labs and the TSH specifically. So we'd like to really focus on your symptoms as well.
Absolutely. And I'll add to that from the, gut perspective, definitely doing some kind of a stool test can be helpful. I always tell people, obviously, to go back to foundations to start off with. If you're kind of struggling to digest your food, you can always start off with like some HCl, digestive enzymes, to see if that does enough. Maybe switch over your probiotic. But if that's not changing the game for you, then it's worth getting some testing done, just so sort of where to start from, and what may need to be some gut cleanup, because, as we know, it all goes back to the gut once again.
It does. Yes. And I would say even just, thyroid, that was something we would probably do, also in this instance as possibly a stool test. I mean, if clients are open to it, but it can give us a lot, and we don't know what was latent in your gut.
Yep. Absolutely. Yeah.
Prior
it's so
to this.
Yeah. And kind of going back to that, cause I feel like we may have dropped a bomb without people fully integrating it, that viruses stay with us.
Yes.
For the long
someone
term.
Just told me the other day, they're like, I just found this out.
Yeah.
Yes.
Cause I think we think it, the symptoms are gone, the virus is gone. No. And I think most people kind of know, like herpes, for example. Most people know that stays with you, whether it's simplex 1 or simplex 2, but like a lot of viruses actually fall within the herpes
Herpes
family
family.
too, right?
Yes.
You know?
Yes.
And so, yeah, these things like stick with us, you know. It doesn't mean that they'll always show up on tests long term, but like they're in there and they can get kicked up. And really looking at sort of the biggest things that kick them up once again is another virus or trauma,
Yeah.
right? You
Yep.
know,
Yeah.
any kind of trauma.
Trauma.
Mm-hmm.
And sometimes people think that trauma has to look one way, but trauma is a very broad
Yep.
term,
Yep.
you know.
Absolutely.
And an incredibly stressful situation, which I would term as trauma, but people might not see that,
Absolutely.
would fall into that.
100%, 100%. It's like, you know, I think a lot of times when we talk about trauma, and this is a big part of it, is like thinking about, well, what happened when you were a kid, right? And that stays with you. But like we can experience trauma at any time in our lives, including having a major illness, including sort of things that are going on in the world in a big way right now, you know, including like being in a car accident, even if it's a very simple car accident. Like there's so many traumatic things that our body, you know, will view it as a trauma, because really it doesn't matter whether our sort of thinking brain sees it as trauma or not. It's like, how does the body process it?
And we are essentially living in a very traumatic time.
Yes.
So
like every day
is a new piece of trauma.
Yep, absolutely.
And so I think that that's important to remember, that things that we're now feeling are normal, are not normal for our bodies to process.
Yes.
And it takes its toll.
Yep. And so within that, you know, it's not easy all the time, but I just was going over this earlier today. Like, you know, I feel like we have to take deeper and more impactful steps on a daily basis to counter this, because we are taking on so much more. And so, you know, I know a lot of times I'll fall into that. Well, you know, naturally, biologically, evolutionarily wise, I should be able to like just like handle these things, you know. And it's like, that's not reality. Like the reality is I need to go above and beyond in my rest and repair time. You know, I need to go above and beyond for me of disconnection. Like, you know, 3 days of not being on technology for the most part was humongous for my nervous system, you know? And while I understand that I'm privileged as hell to be able to do that, and not everybody can do that, I do think that we have lots of pockets where we can make different decisions. Like, even if that's like turn off your phone for 2 hours, you know, in the evening or on a weekend, you know, you can do that, because the more that we're, you know, on technology and scroll, what that's doing to our system, the more that you see, the more that you get angry, the more that you read the comments, the more, you know, that our bodies are not made for that. And it's really wrecking our health. It really is.
Yeah, because we can definitely sustain short-lived, difficult stress. We are designed for that.
Yep.
But it is this long-term chronic stress that people might be like, I don't feel like that. I can tell you, we're all living in a chronic stress state.
Totally.
And so again, like you said, absolutely, we have to go above and beyond taking care of our health.
And I know so often, especially very busy women and mothers and women that run their own business and like are juggling all the things, feel like they can't. But I just want to remind them, you know, that your body will eventually not let you do all those things if you don't take the time now, you know?
Right. Yeah. It will impact your adrenals.
Right.
It will impact
That's where
your thyroid.
Right. Exactly. Like, that's where the chronic fatigue, that's where the adrenal, you know, dysregulation, where you can barely get out of bed, comes from. Like, it will stop you if you aren't able to start to implement these things. And I mean, it's human nature to a certain extent, right? I've been there myself, where you don't make the changes until like it's already sort of past that point. But particularly with the amount of stress that we're holding on our shoulders right now, I'm like, I just see so many women on the verge of like breaking. And I'm like, please just give the gift of yourself, you know, to yourself. Like, even if it's 10 minutes a day where you are just like on your own, just breathing.
Yeah.
You know?
Absolutely. It is a huge gift.
Yeah. Yeah. So
And a
much.
necessary gift,
Yep.
really.
Absolutely.
And we can preach as I want to be transparent. That's something I totally struggle with doing.
Yeah.
You know,
100%. Yeah. It's like,
it's
there's no perfection
no,
in my life around any of this stuff, but
no.
I say it a lot, not only for you all who are listening, but to remind myself,
Yeah.
the
Yeah.
more that I sort of speak it, the more that I implement it in my life, and the differences that I feel, that unfortunately eating the most pristine diet and taking all the supplements isn't going to cut it when you just
No.
have that consistent stress.
Focus on healing our nervous system.
Yeah. Yeah. Because
And
that
that's not something that
underlies.
we're really thinking about very
No,
often.
no. And, particularly for hormones, sorry for everybody who actually listens to me all the time, because I just am beating this dead horse, but it's so true. Like, if you don't work on your nervous system, if you don't calm your hypothalamus and pituitary glands, it's always going to be focused on that cortisol output, that adrenaline and noradrenaline output,
Yeah.
and you are just gonna be fried, and your sex hormones are going to go.
Mhm. Yes. All of
Just
your hormones are going to be like, boom.
exactly. Yeah. Not just your sex hormones, your thyroid
Yeah.
hormones. Yeah, absolutely. Yeah.
It's yeah. And we just can't stress it enough.
Yeah.
Honestly.
We're here to stress how bad stress is.
Yes. Listen to us.
Yes, exactly.
Because we have
Exactly.
both been there.
Yep.
Like, we can tell
100%. Yep.
you from personal experience.
Experience. Yep. And I will say, every day, particularly as things ramp up, I get more and more protective over my time,
Yeah.
to be honest. And it's probably part of aging and everything too. But I recognize how important that, in my system, I need quiet, I need introspection, I need to be out in nature,
Yeah.
in order to maintain any semblance of, and all these things that I used to feel like I had to do. I was like, that was just me feeling like I had to do them. I mean, I still do plenty of things that I probably don't have to do. I'm work in progress here, but there's so many that I'm just trying to cut out, because I'm just like, yeah, I don't need to. Like, that's me putting that on myself. And so I just encourage women to think about that, where you feel maybe expectations from others, or you feel like, oh, I can't give that up, or I can't take space from that. Like, is that true? Just like question yourself, like, is that true?
Mm-hmm.
And where
Yeah.
can you start to find pockets of time for yourself?
Yeah. Who's
Yeah.
chasing you?
Yeah. Yep. Exactly. Exactly.
Yeah.
And it's like, who's like holding the whip,
Yep. Because
because
oftentimes it's ourselves.
exactly. And right now in particular, we have to empower ourselves as women to put ourselves first. Yep. Put our bodies first, all of those things. Yeah.
Yeah.
Yeah. Well, this was an excellent conversation, as
Yes. Thank
always.
you.
Thanks for coming on and
Thanks for having
bantering with me about COVID.
And all the things.
Exactly. I was like, and the tangents. But yeah, the COVID bantering, we'll see if this episode, I have no idea at this point if they're trying to still, what's the word I'm looking for? Like, take down things or
Monitor.
mark
Yeah.
things, I still see people, like, sometimes, the COVID written in code,
Yeah.
like on
I see that all the
Facebook. And I'm
time.
like,
Yeah.
are they? I don't know if they're still, but anyways,
We'll see.
Yeah, we'll see if it's an issue. Yeah.
We can call it long haulers something or
Right.
other.
Right.
And then the tangent.
Exactly.
Please take
And
care
plus
of yourself.
tangents. Exactly. Well, thanks for being here with me.
Thank you for having me.
Absolutely. And where can everybody find you?
You can find me at greenpapayahealth.com. That's my website, and at Green Papaya Health on Instagram and TikTok.
Nice. And for anybody that is having issues with their thyroid, if you don't have a great doctor, or a doctor that's helping you enough, working with Vashti can be life-changing. Like, some of her clients were real struggle buses because they didn't have great support from their doctors.
Yeah.
So yeah. Yep.
Yep. And you can take my quiz if you think you might have thyroid issues. Then I'm including a quiz in the show notes that you can go over and take that quiz and find out.
Figure it out. Yep. Because you don't always know for sure.
Exactly.
All right. Well, I know that you will be back here again at some point.
I will.
And I will see you guys. Actually, we're going to have a little break here for the podcast for just about a month. So I will be sharing some old episodes with you that you can go back and listen to if you missed them the first time. And then we'll see you in season 4 real soon. All right. Bye.
Bye.